Penticton will now be the fourth community in the province to have a high acuity response team, or HART. Based at the Penticton Hospital, one of 6 HART-trained nurses and specialized equipment will be dispatched with the ambulance to the scene, enabling critical treatment to continue uninterrupted during transport of the patient. So what exactly does a HART RN do, and how does this LifePack monitor help them do their job? Well, this demonstration should give you an idea.
Continue CPR.
This is a reenactment of what sometimes takes place inside an ambulance as a critically ill patient is being transported from a remote rural community in the South Okanagan to Penticton Regional, or even as far away as Kelowna General, a road trip that may take several hours.
What would happen is that there would be a call going to BC Ambulance about a patient in the South Okanagan that was beyond what they usually transport. In the past, they would stop treatment and then take them. But what we'll do now is when they get that call, the ambulance from Penticton will pick us up and take us to that remote facility right away when they get the call. And then we'll pick up the patient, continue the treatment that they had at the outlying facility on the way to Penticton or Kelowna.
Not stopping any medications, giving them monitoring and ventilatory support, where before this team we would actually have to either have a physician leave the site and a nurse leave the site, which would leave the hospital understaffed.
The specialized equipment cost $180,000 and came from an estate donation to the South Okanagan Similkameen Medical Foundation.
What does it do? This is the monitor, and it will deliver electricity. It will monitor heart rate, blood pressure, respiratory rate, O2 saturation, and it will deliver the electricity of defibbing or pacing a patient whose heart isn't working very well on the way. So it's completely charged. It's got batteries in the back, and we have 2 extra batteries. So we have about 8 or 10 hours of battery life just with us. This is the ventilator, so it'll have tubing coming out around to the patient, and it will breathe for the patient. And they're little IV pumps, and we can get blood work from the patient en route and adjust our treatment according to the blood work.
With this new technology, critical blood testing normally done in a hospital lab can now be done in the ambulance.
This is called an iStat, and it's a portable lab, so that en route or in the small hospitals that have to call in the lab, we can actually get some baseline blood work. We're going to be looking at their blood gases to determine how much oxygen are we giving them, too much, too little, do we need to change the amount of volume that they're getting. Also, it will show potassium, which can be quite important for your heart function.
Time is of the essence, and having this additional equipment should increase their chances of survival, for example?
That's the whole thing, is that the out-of-hospital survival rate will go up. And also the support for these outlying communities. I mean, when they, like especially Princeton, they get an accident on the Hope Princeton, they're completely overwhelmed when they come in, so that when BC Ambulance gets the call that they're going out to that accident, we'll be dispatched to Princeton. We'll probably meet them at the hospital. No matter what the condition of the patients are, we can give support to Princeton.
It allows us to reach out to the rural healthcare facilities in Princeton, Karamias, and Oliver to support the care of really sick patients. And instead of using a doctor and a nurse from that facility to transfer that patient to, say, Penticton or Kelowna, we now have dedicated staff to do that. So the end goal is to, 1, support patient care, and 2, to keep the local nurses and doctors in their home communities. Because you can imagine Princeton, for example, has 1 doctor, 1 nurse. When they're gone to, say, Kelowna on a transfer, they're gone for most of the day. So now we are preventing that from happening.
The HART system has been successfully running already in Cranbrook, Trail, and Kamloops.
There's no question, in the last year alone, we have eliminated 550 transfers where we would have otherwise used a local nurse and a doctor. So that's hugely successful from our point of view.
At Penticton Regional Hospital, this is Tim Morton reporting for Shaw.